Psychology 101. Forget what we're selling for a minute. Forget plastic surgery versus aesthetic services versus a facial versus Gucci bags or Dior bags or whatever. Let's just put all that out of our mind. What we believe in is that there is a basic psychology that most people go through when they're making a purchasing decision, whether it's a service or a product, whether it's the medical device rep coming to see you doctors or the pharma rep, Mr. Who knows their Allergan rep. Hi, I'm here again. Whatever it is that's being sold, we know from textbooks, years and years and years of worldwide research, coupled with thousands and thousands and thousands of patients that we've seen in all of our different offices in Miami, New York, LA, Scottsdale, that there's a basic structure to selling things or services. And this is what we broadly call the 7 steps to making a sale. Now, bear in mind, you could probably figure out a way to combine this into 5 or call it the 10 steps or whatever, but basically they're going to follow the same general structure. So we're going to walk through that, and everything we do, before we talk about what to say or how to say it, we're going to talk a lot about why, because we really do believe that you all have different styles. You can see that just in the room. Very different personalities all over, the way you introduce yourselves, your style, your mannerisms, and that's all great. We want you to keep all that. We want you to apply it to the basic psychology. So we broadly believe there are these 7 steps. The first one, now that we're going to talk about this, we are going to broadly relate this to patients. Is it fair to say everybody here deals with patients or clients? Whether you're the doctor meeting them in a consultation before or after your patient consultant does. I know some doctors just go in and do the whole thing themselves. Other people have their consultant see them first, which we'll talk about is probably the ideal way. Other people work at places like a lifestyle lift where you don't even meet the doctor and it's just the whole patient consultant the whole time. Regardless of that structure, and regardless of whether we're selling surgery, services, lasers, facial treatments, cosmetic derm, dentistry, anything that they're going to pay money for, and I'd argue even insurance cases, they still have a choice. They could pick the other person for their Mohs reconstruction, the other person for their breast recon, or the other person for their nosebleed. There's still some sort of sale being made. And wouldn't you agree, and this is one that's easy, and we start off real simple, and you all already know this, we want to start by building rapport. Are people going to buy because they like you? In rare cases, I think so. I just like them so much. Here's my money. When it comes to someone, and I'll be kind of extreme in my analogies, so I got all kinds of weird ones. In the most case, if someone's going to cut open your face, the answer is no. For the most part, they're not going to say, I like him or I like her. You can cut my face open. Because that's fundamentally what we do. We make incisions, we blast them with lasers, we put peels. I mean, I've gone in for a facial before, my wife sent me in, and I was a little scared, to be honest. I'm like, don't over-exfoliate my skin away. I don't know what they're doing. So, for the most part, people aren't going to buy solely because they like you. But let me ask you this question. Will you not buy if you don't like them? Absolutely. But they're a great surgeon. Does anyone still not care? If the surgeon is mean, if the patient advisor is mean, if the nurse is mean, if the receptionist is mean, and not just mean, but unprofessional, incapable, not positive, any number of things, it doesn't much matter how wonderful your work is. So it goes without saying, the first thing we have to do is break the ice and build rapport. We'll come back to exactly how later. The second thing that we should be doing after we build rapport psychologically is we should be gathering goals and needs. This is what we call a consultative sale. Can anybody define for me, or does anybody know from other training what a consultative sale is versus a typical sale? That's good. That means we're going to learn something here today. I like that. Okay, good. If everybody knows all the answers, we're in trouble. So let's talk about it. What do you guys think of when you hear about the word consultative? What does it bring to mind?
Questions.
Questions. Why do we need to be asking questions? Why are we consulting the patient?
Find out their goal, what they need.
Find out what they want. Now, there are products you don't have to do that with, right? For example, you might go in and have a product to sell, and you're just going to sell them on it. Can anybody think of something that would fit that?
Milk.
Milk. Milk's on the shelf. You want milk or you don't want milk? Now, maybe there's a few types now. 10 years ago it was milk, and now there's soy milk and this milk and that milk. But there's something like milk, right? Kraft singles, you either want them or you don't want them. They're kind of cheese, they're kind of okay. You buy them or you don't. Those types of sales are easy. You don't really need a salesperson for them. You just stick them on the shelf and see what they pick out. And all you really need is a showman or a show shelf or anything. An inanimate object can sell as well as you. When we're talking about higher ticket products, when we're talking about people interaction, you've got to be consultative. So what happens is this. Most patient advisors do this very, very well. And will say, you know, Logan, I know you told me a little bit over the phone, but tell me a little bit more about what your goals are, what are your needs, what are you hoping that Dr. Bergeron might be able to do for you? That's wonderful. You know where we usually miss it, as we'll come back to later? We usually miss it at the doctor level. Logan tells Dr. Bergeron, you know, the patient wants a facelift or the patient wants a liposuction. Great. The doctor oftentimes goes in and says, I heard you want liposuction. That's scary. That's bad. We'll talk about approaching the patients. And so what we're going to talk about a little bit later is it's not just at the patient advisor level. It's then at the doctor level. It's then at the follow-up level. Every single level of the way, we need to be constantly consulting and asking questions before approaching. So once we know their goals and needs, they're going to feel like they were what? Listened to. They feel heard. And if anyone ever doesn't feel heard, we're in trouble. And let's talk about the psychology behind that. Ladies, have you ever found that if your husband or boyfriend or partner simply listen, it tends to make things a bit better? Whether they agree or not, hopefully they agree, they better agree, but if they don't, sometimes it's just about being heard. I know the guys probably feel that way as well. Sometimes I know I'm wrong, but I've got to spit it out. I'm like, I'm just so frustrated by this and this and this and this. And my wife's like, honey, I hear what you're saying. You're frustrated because of this and this and this and this. Yeah. Okay, honey, I hear you. That alone makes everything better. I feel heard. I'm no longer going to go back later and say, that doctor or that patient advisor didn't really understand what I was asking for.